Thank you, Mr. Chairman.
Senator Menendez.
Thank you, Mr. Chairman. I wish they could take their conversations off of them.
Could you all take
Thank
that?
you very much.
Thank you.
I have a little hearing issue. Mr. Becerra, welcome. It's good to see you again. A few quick questions that hopefully you can help glide through with me so that I can get to some other things. You were a member of the Ways and Means Committee, which is almost the equivalent of the Finance Committee. I say almost because we have pride here in the Finance Committee of the House of Representatives. Is that not correct?
That's correct.
And as such, were you there during the period of time in which the Affordable Care Act was being legislated?
That's correct.
Were you instrumental in various parts of the Affordable Care Act?
I was in those rooms.
And as part of that, you became familiar that the Affordable Care Act created the opportunity for millions to get health care coverage who did not have it before, correct?
I was very active on those provisions.
And to create affordability for millions who found it less affordable, who created Medicaid expansion. Is that fair to say?
That's correct.
And who also closed the donut hole for prescription drugs for seniors. Is that fair to say?
That's fair to say.
You had all of the experience during that whole period of time. It also created a special provisions for women's health. Is that fair to say?
Yes, it is.
Now, as Attorney General of California, California has the 5th largest economy in the world, is it not, if it were an independent country?
That is correct.
As Attorney General, what was the size of the Office of the Attorney General?
We were several thousand, over $1 billion budget.
So several thousand over $1 billion budget. Now, let me ask you this. When you took an oath as when you were chosen to be the Attorney General of the state of California, you took an oath, did you not?
I did.
And in that oath, I believe that part of that oath was to preserve, protect, and defend not only the Constitution of the United States, but the Constitution of the state of California and the laws of California.
That's correct.
You don't pass the laws, you defend them.
That's correct.
Now, let me ask you this. If you're successful, and I believe you will be, at being confirmed by the Senate, and you take that off, then you're going to defend the laws of the United States as they exist at the time.
That's correct.
I find it interesting that many of my colleagues have raised issues about you being a lawyer and without sufficient experience. The reality is that thousands of employees under your direction experienced firsthand in creating the most significant landmark legislation on health care and dealing with issues of Medicare and Medicaid within the Committee of Ways and Means jurisdiction. That seems to be a problem, but the previous Secretary of HHS was also a lawyer. The only thing is that he was a lawyer at a drug company that ultimately did a pretty good job in fleecing insulin patients. So I hope, I don't think that we'd see that from you. Let me ask you a few specific policy questions. You and I had an opportunity to talk. Will you work with us on improving diversity in clinical trials? Because this is an area that we think lacks, and I've written to all of the companies that are engaged in clinical trials. Most of them have been pretty responsive, but it's something I think we need to do in order to make sure that all of America is represented in these trials.
Senator, absolutely. As I always say, if you have bad inputs going in, you're going to produce bad outputs, and if we're going to start having studies reflect the American people, we have to have good inputs.
Would you work with me and others to improve diagnoses of Black and Latino dementia patients as we begin to address Alzheimer disparities in communities of color?
Absolutely.
One of the things of the pandemic is that it has magnified the incredible disparities that exist in our society, particularly in terms of the health care of minority communities. Will you commit to working with me on ways to reduce the disparity for communities of color in the delivery of our health care system?
Yes, sir.
Let me ask you a question. We've had a bipartisan support here for a program called McVeigh Maternal Infant Early Childhood Home Visiting Program. I used to work with Senator D-N.J when he was on the committee on it, and I look forward to working with others. Do you support an expansion of this valuable program?
Senator, as you know, my wife is a maternal fetal medicine specialist, and
So I have an in-house lobbyist?
you've got me squeezed between you and her, and the response is absolutely looking forward to working with you.
And then finally, we were able, part of my work here was to ensure that we could include 1,000 new GME slots that Congress provided. I would like to get you to work with us to ensure that we quickly and efficiently implement that provision of the law.
Done.
Thank you very much. Thank you, Mr. Chairman.
I thank my colleague. We're just going to